Here we are. So I will try to make it as interesting as possible for you. I'm just going to start my talk with IVF legislation in Greece. I have some amazing news to share with you tonight, and that has to do with some changes in the regulation of Greece. So I'm saving this for the end, and hopefully I will keep you interested until then. I mean, many of the questions and the emails we get every day refer to the legislation of IVF. So I'm sure that this affects a lot of couples, a lot of patients all over the world, and a lot of clinics who wish to refer patients to Greece, a lot of colleagues. And therefore, I think it's very interesting. For those who don't know me, I've been around for about 30 years. I'm very privileged to have served patients from more than 40 countries all over the world and created families in those countries. I have primarily practiced in the UK and Greece, and I have been a member of the Royal College of Gynecologists of London and also a fellow of that college. And I have been privileged to have been member of the British, the European, and the American fertility societies, as well as a board member of many societies, and in particular the Greek Society of Reproductive Specialists. My generation have tried to shape the clinical practice of IVF and have tried to not only to serve our patients, but also to lead the next generation into improving the practice and the service. So what about the legal framework? I mean, this is something that each country has regulated. And at the moment, although there's a lot of differences throughout Europe, there is quite a lot of common facts and factors within the European Union. So in general, the Greek legal framework is considered comprehensive, liberal, patient-friendly, and progressive, although it was instituted roughly about 15 years ago, and we all feel now that it's time for a refresh and time for an update of this legal framework. And part of this update is the fact that now we are working towards increasing the age limit to 52, from 50 to the female age limit to 52 years old. And that is a huge relief. That would be a huge relief for many patients all over the world, especially the ones who've been stranded by the coronavirus issues. So the general requirement in Greece in order to have, in order to undergo fertility treatment is that the age of the woman has to be 50 at the moment, but hopefully 52 very soon. That they complete some viral blood tests to ensure their health and also that there's no transmission to the child or children. And there's no problem in Greece with regards to marital status. I think this is very important. So any female, single or married, or in a relationship, in a heterosexual relationship of any kind, they would be legal to undergo IVF. Cloning, of course, is not allowed in Greece, human cloning. And there are some particular techniques which are also not allowed, and in particular, sex selection for family balancing. For social reason is not permitted, although sex selection and pre-genetic testing for medical reasons is allowed. So what patients do we accept? We accept married couples, unmarried couples, heterosexual couples, couples in civil partnership, and single women. And at the moment, same-sex couples, gays or lesbians, are not legally allowed in Greece to undergo IVF. Now, the importance of consent cannot be overstressed, and this is because the consent requirements also include a lot of areas that the patients should be informed about, and in particular with regards to safety and success. And of course, if there is a single woman or an unmarried couple, then the consent is in the form of a legal notarized document. And part of the consent is also including the future of the cryopreserved material. So we need to know beforehand what is the possible potential future of gametes that we store in our facility. So how many embryos can we transfer? The number of embryos transferred on each cycle, of course, is up to the clinical judgment. However, there are some very, very strict rules here. So in women under the age of 35, we're only permitted to transfer 1 or 2 embryos, no matter what. In women between 35 and 40, using their own eggs, we can transfer up to 2 embryos in the first and second cycles, but 3 embryos are allowed in the third cycle. Now, women over 40 using their own eggs, they may be transferred with up to 4 embryos. And of course, this is taken into account the fact that there's a huge possibility of chromosomal anomaly in women over the age of 40. Of course, all of this is based on the fact that we want to avoid the twin or triplet gestation and its associated complications. Please give me one tick because my office is still running at the moment. Thank you, Lecter. Now, in terms of egg donation, and when we use either donor eggs and donor sperm, we can only transfer up to 2 embryos. So under no circumstances can 3 embryos be transferred, which I think is fair, since the majority of us now are aiming to transferring 1 healthy embryo at a time. Now, what methods are allowed in Greece at the moment? In vitro fertilization, IVF, IUI, or the surgical retrieval techniques, and also ICSI, egg and sperm donation, frozen embryo transfers, postmortem fertilization, cryopreservation, and surrogacy. And may I stress here that Greece at the moment is the only country within the European Union in which surrogacy is legal and regulated. IVF, we all know what IVF is, and here we will talk a little bit about the legal aspects of homologous. In other words, own eggs, own sperm IVF, and heterologous, the use of egg donation and sperm donation. So, heterologous IUI or IVF. The egg donors, by law in Greece, they have to be under the age of 35. However, not most, but some units, including ours, we only use egg donors under the age of 30. So it's understandable that a donor in their 20s are highly fertile and potentially highly successful. Sperm donors, by law, they have to be under the age of 40, and overall the donation has to be anonymous. So the identity of the donor may only be disclosed on medical grounds and cannot be disclosed on any other grounds, and only non-identifying information can be given to the recipient. And in particular in Greece, we don't use photographs, baby photos, or any other sort of marketing material that may be used in other countries of the world. So in terms of matching the donor, of course, there's the very strict criteria, depending, of course, on the clinic. This is a clinical decision based on physical, genetic, and psychological characteristics. However, none of those details are disclosed. So we're only using non-identifying information that we share with the couple. And conversely, the donors, they have no access to the offspring, and the offspring no access to the donor. And to be honest, donor anonymity is more or less the norm in continental Europe at the moment. And in my opinion, this is one of the reasons why egg donation is popular and it's available. And we have donors coming forward because they're covered by the anonymity, so they can be altruistic and anonymous at the same time. So sperm donation follows the same rules, and as I discussed before, of course, fresh sperm donation is not allowed from the third donor, so only frozen cryopreserved sperm is possible, legal, and available at the moment. With regards to compensation, there is a compensation. It's not a payment, it's a compensation given to the donor for the physical exhaustion, during the donation process, and that is totally legal and covered by the legal framework. Now, post-mortem fertilization is possible under some rules and circumstances. I'm not going to go into detail about this. Now, surrogacy has been legal in Greece for many years, since 2005. However, international surrogacy has been made possible only in the last 7 or 8 years. And of course, this has attracted many couples and many single women from all over the world coming to Greece for surrogacy. It is legal, regulated. It has some advantages over other countries. And the most important advantage, in my opinion, is the fact that the court order and the parental order is issued prior to the IVF process. And that takes away all the stress of the parents regarding the parental order, which is issued beforehand. And of course, it's a security measure for the surrogate carrier herself, that the parents will be the commissioning parents will be the parents of the child. Now, there's a lot of issues associated with surrogacy. I think we should have a special event to cover that. All I can say is that surrogacy is a very complex and complicated sometimes process that involves many people, the parents, commissioning parents, the surrogates, sometimes donors, egg donors, sperm donors, and so forth. And of course, it is one of the most complex fertility treatments we can offer. However, for many couples, this is the only way to childhood. And it is very important for them to understand that this is legal, regulated, and available. So with regards to surrogacy, the carrier has to be between 25 and 35 years old. She has to have at least one child of her own, and she's not allowed by law to use her own genetic material. Now, cryopreservation is legal. More or less, this is commonplace within the European Union. All the genetic material has to be kept in a licensed cryobank. Invariably, all IVF units have their own cryobanks, and there's a special license in Greece for a cryobank on top of the IVF unit license to ensure quality and safety. Now, pre-implantation genetic testing. This is, of course, a very important advancement of technology and science, and has made possible the elimination of some diseases before implantation. Furthermore, over the last 10 or 15 years, it has been used for also screening for standard common genetic anomalies that may be associated with age, like Down syndrome, with a female age, like Down syndrome or Edwards syndrome. And also it has been utilized, of course, to exclude anomalies that are inheritable. However, pre-implantation genetic PGTA genetic testing in Greece is legal and regulated. However, recently it's been implemented that all of our units, although we are licensed units, we require a special license in order to perform PGTA. And of course, we have to follow some certain criteria for that. So it is possible, but it is a little bit bureaucratically regulated at the moment, and this may be causing a little bit of delay. Now, what's the comparison between Greece and other systems? And in particular, I will talk about the UK, Serbia, Italy, France, Germany, and Spain, which are within Europe. Of course, if there's any specific questions about differences with other countries, and if I am familiar with those, I would very gladly share my experience. So what happens in Italy with regards to egg donation? At the moment, there's limited availability. Although it is legal, it is not available, which is a little bit of an oxymoron. So it was illegal until 2014. It is legal now, however, it's not available. And that's why Italian patients at the moment, they either have the option of using frozen eggs shipped to Italy by other European countries, or they would still need to travel themselves physically to Greece or to other countries like Spain, Prague, and Belgium maybe, in order to receive egg and sperm donation. In Germany and Turkey, egg donation is illegal. In France, there's limited availability of egg donors. That's why French people travel. We do get some French here in Greece as well, although, in my opinion, most of the French usually travel to Spain. So, which are the facts about fertility tourism at the moment? Fertility tourism is here to stay. It's been happening for more than a decade now, and it seems to be on the increase, mainly because of various reasons, but of course legal barriers is one of those important reasons. So there's legal barriers preventing patients from receiving treatment within their own country, and therefore traveling to another destination in order to receive a treatment there. So fertility clinics in Greece are all licensed by the Greek National Authority. There's quite good level of science and technology, regulation and quality assurance. The legal framework is what I've described before. At the moment, well, up until a few months ago, there was no waiting list, but unfortunately, due to the COVID situation at the moment, there are some waiting lists being built up, because with all this close and opening, people are queuing for the opening times, and sometimes clinics, they cannot cope with the demand. The cost is still affordable. We hope we keep it this way, although the demand for more regulated standards, the demand for the COVID compliance, the demand for quality assurance in terms of ISO standards. I mean, I think Greece is amongst the very few countries in the world where fertility clinics are not only required to have high quality standards, but they need to be ISO certified by regulators on two grounds, on both quality and management, but also on laboratory safety ISO standards as well, which of course is a procedure that not only does it guarantee quality and success, but also it increases costs. So we're hoping that we should be able to keep the costs as low as possible. And of course, there's excellent reviews about Greece, and Greece is one of the emerging fertility destinations. So this is the authority that regulates us, that regulates the units, and is responsible for the accreditation, designation, and licensing, and keeping the register of our activities. We all refer to the European Society of Human Reproduction as well, to ESHRE. Through our authorities, we publish our results there, and of course, we receive all the guidance and updates on science and technology and good clinical practice. Some papers about crossing borders for fertility. I'm not going to go into detail for this. And I will finish here, because I can see there's some questions to be answered, by mentioning a few future challenges in the legal framework of Greece, and one of them is the age limit. So sit tight, but I think that in the next few weeks we should have the announcement of the increase of the legal age limit for the female to 52. That's in the light of the COVID pandemic that has prevented many women to go forward and have their IVF, especially those very near the 50-year-old mark. The same-sex couples, again, there's a lot of talks at the moment between different authorities whether that should be ethically or legally allowed. This is not up to me to judge, but of course it's one of the future challenges. And single men, treating single men, that would also be one of the future challenges. The cryopreservation duration, that's also one of the challenges that has to be met and solved by the authorities. And finally, the transportation of genetic material. It seems that because of the COVID restrictions, physical traveling seems to be becoming more and more complex, whereas transportation of genetic material, on the other hand, has been proven to be safe and effective and regulated, and therefore it is probably going to provide some extra options for patients all over the world who rightfully wish to become parents. Thank you very much. Apologies again for the delay today. It was due to some Hollywood filming in my neighborhood, and that caused amazing traffic jams. Thank you for waiting for me. Thank you for all your questions and your patience. Thank you, Caroline, for the invitation, and the Fertility Society for this amazing event. And I'm ready for questions, queries, challenges, and any suggestions for the future. Thank you very much.
Thank you so much. I'm not sure if you can hear me. Okay. I believe you don't hear me. However, Dr. Tsakos, I will show you what I would like you to have a look at. Just bear with us, okay? I just want to let Dr. Tsakos have a look at this, okay? I know that you cannot hear me, but have a look at this.
I can hear you now.
Okay, great.
Yes.
Happy to hear that. Excellent.
Yeah.
I just prepared a message just in case, but if you can hear me, all good. Perfect. Thank you so much for, again, amazing presentation. I'm very happy that you were able to make it. And of course, right now, it is time for our Q&A session. So let's get going with our first question that we've got from Anna. So why transferring more than 2 embryos, since the studies prove that you don't have any increasing in clinic pregnancies, and we are going to single embryo transfer for all treatments?
Thank you, Anna. This is an endless discussion, but I mean, all I have to say, I mean, by the way, are you medical, or are you a scientist, or a patient? Anyway, until you type your answer, it's a huge discussion. I mean, of course, we all aim for a single. Oh, you're an embryologist, excellent. So we're all aiming for singleton pregnancies and singleton deliveries. However, as you know, as an embryologist, it's not just the number, it's the quality that can be variable. So sometimes, we cannot always guarantee a top quality blastocyst for all our patients. And even if we do, for a 40-year-old or a 42-year-old, a top quality blastocyst doesn't mean that this blastocyst euploid is normal chromosomically. So, double embryo transfer will always be an option. And also, apart from the scientific and clinical and ethical point of view, and apart from, most of us agreement that we wish to go for single embryo transfers of a normal, hopefully euploid embryo, there is the human factor as well. So if our patients request for their own reasons and following careful counseling that they wish a double embryo transfer, I don't think we can refuse or deny them that option. Of course, whether that increases the chance of a single pregnancy or whether that increases the chance of twin pregnancy, again, depends on quality, depends on characteristics, depends on the patient characteristics, and so forth. So I think it's an endless discussion, but all I mentioned in my talk was the legal regulation, and I think it's very important that in Greece it is legally not allowed to transfer more than 2 embryos as a general rule, which is a very good step forward, as we know that in many countries, that even within Europe, they can travel up to 3 or 4 embryos with disastrous outcomes.
Perfect. Thank you so much, Anna, for your question. It's good to see you here as well, of course. So thank you so much for your question, and Dr. Tsakos, of course, for your help with that. Let's have a look. If you can tell us how much does the surrogacy cost? What are the costs in Greece?
Sure. To be honest, I don't really know. I don't know the exact costs, and this is not up to me. I'm a medical director and clinical doctor. However, all I can say is that it's expensive. I mean, surrogacy treatment is a very complex and expensive type of fertility treatment. It's the end of the road for some couples. Thankfully, not many couples, but for some couples, this is the only way for parenthood. The only way to achieve parenthood. It is an expensive, it is a stressful, complex procedure that takes a long time to be accomplished. I mean, minimum of maybe 1.5 to 2 years. All being well, and it's definitely very costly. However, if you're particularly interested, drop us an email to info@embryoclinic.eu, and I'm sure that my coordinators should be able to answer you specifically.
Perfect. Thank you so much. I will put this email in a second in the chat section just so everyone has it. And if you would like to get some more details, as Dr. Tsakos mentioned, you will be able to get them. Let's have a look at the next question in the meantime. So what genetic tests do you do for when it comes to donors?
Sure. We do the standard genetic test that most people do, which includes karyotype, peripheral blood karyotype, and the full cystic fibrosis gene testing, not just the DF508, which is the commonest cystic fibrosis gene. We do the entire range of gene testing, which covers 99.9% of possible mutations. On top of that, we test for Fragile X on egg donors. So these are the genetic tests, of course. We do more testing apart from genetics, which includes all the viral testing. We do a formal psychological assessment and so forth. So, particularly genetic testing, we do those three: karyotype, Fragile X, and the full cystic fibrosis test.
All right. Thank you so much for answering this question as well. And I put email address right here in the chat section, of course, so you can use it. And if you would like to get some more details on the prices, this is the way to do it again as well. Okay. What about cost for egg donation? Are you able to give us an example?
Sure. But I still don't know exactly the figures. So please drop us a line to info@embryoclinic.eu, and we should be able to answer that. I mean, all I can say is that egg donation is also a complex procedure. It's not as complex as surrogacy. However, it involves a lot of work, a lot of counseling, a lot of screening of the donors. In my clinic, we only accept probably about 1 in 5 donors that come forward. As I mentioned in my talk, we only accept donors under the age of 30, so a good proportion of the potential donors are excluded by age alone. So if they're over 30, although legally it is allowed up to 35 years old, they're rejected. And of course, then we run various tests, including the genetic tests I mentioned, plus all the viral testing. We do microbiology testing, of course, the psychological assessment and so forth. So only 1 in 5 roughly donors are accepted in our program. And as you realize, this is the added cost of that is the apart from the screening costs, it's the cost of donor drugs, the stimulation drugs, the monitoring procedure, and of course the compensation, which is legal and acceptable, both ethically and legally in Greece. So that, of course, increases the overall prices. However, still egg donation in Greece is reasonably priced, is roughly about half price compared to the UK. It's maybe 30% cheaper than Spain, and it's more or less the same as in the Czech Republic, just to give you a rough idea. The exact figures my coordinators should be able to email to you.
Perfect. Thank you so much indeed, because actually there are more questions on costs, okay? But as Dr. Tsakos mentioned, just drop a line to the team, customer service team, and I'm sure they will be more than happy to help you out with more details, because as you can see, another question on IVF costs.
Sure, I know this by heart. This is easy. IVF in Greece is between 3,000 and 3,500 euros, depending on depending on whether for example, there's freezing or whether there's some add-ons in the lab and so forth. So, a rough figure is 3 to 3.5 thousand euros at the moment. Although, as I say, there's unfortunately there is a possibility that prices may increase because of COVID epidemic. Most of the products have started to increase. Most of the technology equipment are increasing for some reason that perhaps some of us don't understand and so forth. But at the moment, the prices have remained the same, and it's more or less at that level.
Excellent. Thank you so much indeed. And Anna has added one more question. So do you exclude donors when you find a recessive monogenic abnormality?
Yes, we do.
All right.
As I said, in my clinic, we have a very low threshold in rejecting donors. And so any abnormality, either in the history or in the psychological assessment or in the genetic testing, any even minor abnormality would be a reason for rejection.
Perfectly understandable then. Of course. There's a thanks from Anna for you for answering her questions as well. Thank you so much, Anna, for joining us tonight as well and for staying here with us as well. And let's have a look, okay? Angela has another question here. Just to clarify regarding genetic testing, how many of the actual carrier testing diseases are tested? Example, here in the US, there are the 301 genetic diseases that are tested. Do you do all these 301?
We do the standard testing that I mentioned, and as I said in my clinic, on top of the standard, we do some extra tests. For example, they want to, XY microdeletion, and also, of course, we test for thalassemia because in Greece, thalassemia is a genetic disease, fairly common. So we test for that based on the legal framework. On top of this, of course, if the couple wishes, we can test for the 301 genetic diseases. We also have a package for 500 genetic diseases and all that. So on request, we can test for anything that any couple would be wishing to test for. Now, of course, in the US, as you probably know, egg donation is probably 7 to 10 times more expensive than it is in Greece. And this is one of the reasons why we have a lot of US patients flying out to Greece for egg donation. Actually, we have one from Detroit coming next week for the second baby, having delivered the first one successfully. So, there's no end to genetic testing. And of course, on request, anything could be done at extra cost, of course, but still the overall cost, but on top of that, the cost effectiveness of treatment in Greece is very favorable. And that's why Greece is so popular. That, as I said, at the moment, there is unfortunately the feeling that there will be some build-up of waiting lists. This is something we didn't have before, but unfortunately this is happening, especially after the COVID epidemic.
Thank you so much indeed. And as you can see, more questions are coming up. So let's have a look. Angela has added one more question. Do you do PGTM for embryos that have a specific disease above the usual PGD 24? Sorry.
Yes, absolutely. We can. Technically, we can test for anything under the sun. And of course, that requires to have a medical indication. So yes, indeed, we do.
All right. Again, thank you so much, Angela. It's really great to see you back here. Okay. Thank you so much for this. Well, next question. I'm not sure if you can answer, but I will show it to you. Do you know surrogacy or donor X is legal in Ireland?
Well, surrogacy is definitely not legal because, to my knowledge, Greece is the only country within the European Union at the moment. Not even Spain, which is the mecca of IVF, as we all know, is offering legally surrogacy services. So within the European Union, Greece is the only option at the moment. Of course, in continental Europe, there's other options like Georgia, Ukraine, Russia for surrogacy. And I think that's about it in Europe. And then it's the United States. So surrogacy is not legal in Ireland. It is not possible. Actually, we do have some interest from Irish couples for surrogacy in Greece. Now, egg donation, I'm not exactly familiar what is the situation in Ireland, to be honest. I cannot answer that.
All right, of course, understandable. Thank you so much for that, and thank you so much. Sorry, I'm just waiting for some more questions. Okay, sorry, I just wanted to, because Angela was our frequent, yeah, she was here many times. She has another question for you right here. So, what is your opinion in the foreseeable future regarding anonymous donors? Will you be able to see photos of donors, maybe?
I don't know, Angela. I'm sorry, I do not know. At the moment, it's anonymous. I think it's going to stay anonymous for quite a while because, as you probably know, in Europe, in continental Europe, including Greece, it's not very easy to change the laws. And my feeling is that it's going to stay anonymous for a long time. However, I mean, in selecting donors, I mean, although it's a wonderful marketing tool to show photographs, but trust me, I don't look anything like what I used to look when I was a child. So I think it's nice and happy for many people to see, what the donor looked like, but I don't think it has so much to do with reality when it comes to the actual child. And as far as I'm concerned, as a clinician, as a doctor of more than 30 years experience now, the most important is not perhaps the looks or the baby looks or the adult, the young adult looks of someone. Most important is the general characteristics, the genetic characteristics, the age of the donor, of course, and some other factors that perhaps are not very good for marketing, but they're good for the substance of the whole of the egg donation process. And in Greece, in Europe, in my clinic, it's the medical team that guarantee them the matching, that guarantee the selection of the perfect donor for every single woman and every couple that we treat. And this is a huge responsibility, but believe me, thankfully, it is possible, and it is creating beautiful families all over the world.
Perfect. Thank you. Thank you once again, of course. And there's one more question right here. So let's have a look. Okay. So do you use Lupron depot for patients with endometriosis before frozen embryo transfer? If yes, for how many months before transfer?
Oh, okay. This is not within the scope of talk, but thank you so much, Mariam, for the question. I mean, endometriosis is one of my passions. And it's a disease that affects a lot of women. It's a disease that is causing a lot of problems in everyday life of those women, not just infertility, but also other problems. And of course, we have to address that. It's the silent epidemic, in my opinion, endometriosis. So whether I use Lupron or not depends on the endometriosis is the answer. It depends on the stage of the endometriosis, depends on the previous history of that woman and so forth. So it's not a very easy answer to give. I try to individualize. To be honest, I'm a great believer of surgical management of endometriosis. I feel that endometriosis is best treated surgically in many occasions, especially when it's creating symptoms. So I prefer not to have endometriosis at all. I prefer to have had successful surgery, either laparoscopic surgery or robotic surgery for endometriosis before attempting fertility treatment. However, if there is endometriosis there, either visible on scan or on MRI or clinically palpable or clinically suspicious endometriotic lesions, yes, then I would definitely consider using Lupron. I must admit that I'm a big fan of Lupron overall for frozen embryo transfers anyway. And maybe one of the reasons is that always in the back of my mind is that there may be a possibility of undiagnosed endometriosis. So yes, I tend, although I don't like to feel, to think, or to see endometriosis when when I do embryo transfers or just before the embryo transfer. However, yes, I'm usually tempted to use Lipo depot. How many months depends is the answer. Maybe 6 to 8 weeks.
Wonderful. Thank you so much indeed. Once again, as you can see, there is a thank you just right here. At least at this point, I don't see more questions. However, as you always know, if you have any more, you know what to do. Just either type those in right now, and if not, you can always get in touch with Dr. Tsakos, his team. There is a link, or there is also an email address in the chat section you can use, and I'm sure they will be more than happy to help you out. Someone is typing, so let's give it a second. Let's see if it's another thank you. Yes, it is for actually another thank you. As you can see, Dr. Tsakos, thank you. It's always great to listen to you and keep learning. Perfect. Thank you so much. So we will be finishing. Dr. Tsakos, I'm so very happy that we were able to make it and you are here with us and you were able to present and all worked very, very well. Before we finish, is there anything you would like to add?
I would like to thank you once again for organizing these amazing events. I would like to thank all our patients, our audience, everyone out there. My heart and everyone's heart is with all those singles and couples somewhere in the world who are just waiting to hear some news, some good news, waiting to learn something more about their situation. Those who don't give up, those who keep fighting, keep hoping and keep dreaming of becoming parents. And thank you for making all of us a little bit better every time with your questions, with your feedback. For giving us the strength to go on into this wonderful world of fertility. Thank you so much. Thank you, everyone. And it's my absolute pleasure to be with you.
It's always a pleasure to have you back here, as you know. And I can only tell you that Dr. Tsakos will be back, okay? So, of course, as you probably don't know yet, it's not official, but I can tell you that we will be back. There will be a break in August, but we will be back in September. And I know that Dr. Tsakos will also be back, so already I'm very excited to have some more webinars with you, as always. Thank you so much. And, of course, thank you for staying with us. Everyone, for your questions. You never disappoint, and thank you for your patience. It's been a little bit more difficult tonight, but in the end it worked, and that's what matters, right? And just to let you know, of course, this has been recorded. You will have a chance to watch this tomorrow on myivfanswers.com. And if you subscribe to our YouTube channel, you know that there are plenty of webinars right there. Also with Dr. Tsakos, I don't even remember how many webinars we've done so far. So I'm already looking forward to the next one. Dr. Tsakos, thank you so much. Everyone have a lovely evening until our next event then, okay? Bye-bye.
Goodbye. Thank you again. Thank you.
Bye.